It's my feel-good breakfast show.
Welcome back, Mzansi. So good to be with you. And yes, let's get your morning started off on a perfect note because, my friend, we always love to send you off with a whole lot of information, but also with some good vibes. But let's start off with a very important conversation because in this G20 series that we've started here on your Feel Good Breakfast Show, we've already unpacked what the G20 is, right? Who exactly is at the table, why financial stability matters at home. And today we turn to health, how the G20 aligns countries on universal health coverage, pandemic readiness and innovation so that care becomes cheaper, closer and safer for families in South Africa. And this is why we've got with us today Dr. Dino Rick, CEO of Ouderay Africa, to translate the headlines into real-world action so that we can all understand, right? Everyone, let's give him a feel-good welcome. Feliz! Doctor in the house, how are you?
Good, thanks. Great to be here.
It's amazing to be with you. Thank you so much for taking the time to come and break this down for us. Because I think sometimes it can be a little bit, I want to say scary to look at certain headlines. But having you here, having us to just really be able to get into it, I think let's start with particularly, the health, right? Because we know that the G20 is going to be jumping into that. But when we actually look at it as South Africa, what exactly are the small practical wins that we could possibly look at from the next 12 to 24 months that could help us see that something's actually happening?
Yeah, great. Thanks so much for having me.
Of course.
I think the G20 is very exciting, especially because we're hosting it. And I think from a healthcare perspective, there's two things that know no borders. Yeah. One is health risk, and we saw this with COVID and needing to be ready for pandemics.
Yes.
This will be a massive topic at the G20, how we share health data, how we prepare as a Southern African community and global community. The second is innovation.
Yeah.
So when we think about the G20 and healthcare, global innovation is exploding more than ever before.
Yeah.
We see digital tools, we see AI, we see the potential to fill a lot of gaps with these types of innovations.
Yeah.
This will be topical at the G20. Regulation around innovation is another topic. You right now with AI, we have, it's very new. We have somewhat of a vacuum, and some regulators need to step in and understand, okay, what makes it safe for people to use, what doesn't, and this is another big topic at the G20. The last is investment.
Okay.
So we've seen as a South African community over the last year within our healthcare sector, we had foreign investment from certain countries. Some of that's been lost. So part of the G20 will be lobbying new partners around health investment in our health ecosystem.
And hopefully we'll be able to do that successfully, right?
I think so. I think we need to have faith. We need to, have hope. And I think with the positive attitude, we'll get there. 100%.
I agree with you. And this is why then I also want to ask, especially with your work in terms of employing AI and even digital tools, what's one use case that you really see in terms of delaying costs, or rather delaying just a little bit of what we would call the ways in which things kind of happen, but also cutting costs? What are the ways that you see really the blockage that's happening in the country nationally, sort of maybe even becoming a little bit less after the G20?
So I think, you mentioned it earlier, the G20, one of the focuses in healthcare is universal health coverage. And this means everyone being able to access affordable healthcare without ruining them financially.
Yes.
It's pointless if we need to access a health service and we go into debt to do it, and then we come out of that emergency and we're in a lot of financial trouble. So when we think about healthcare, we think about quality, affordable access, and a big part of that is through primary healthcare offerings.
Yes.
And that will be one of the themes at the G20. You spoke about digital tools.
Yeah.
And when we think about the primary healthcare system, we want to match a supply of primary healthcare and prevention with the demand of people. And digital health tools provide a lot of elasticity to make that match happen.
Yeah.
So let me give you an example. Telehealth services. You don't need to have a doctor necessarily in every location. You could have a centralized group of health experts behind a telehealth service that could consult to clinics around the country or to people around the country. When we think about AI innovation, we're seeing a lot of AI companions.
Yeah.
So on your WhatsApp, in your hand, having an AI doctor or nurse that you can ask information to, and that when they need, they'll refer you to a human in a telehealth consult.
That's incredible.
Then you can refer into brick and mortar, a pharmacy or a clinic. So rethinking that paradigm will be a big part of what's happening.
That's incredible. And Dr. Rick, I'm somebody who genuinely, like I said earlier on, sometimes it can be daunting to look at something like the G20, right? But the fact of the matter is that it really affects affects us. So this is why we need to be able to understand it. And I love that we're even looking at employing, digital tools like that, because I know for me, my aunt is my AI companion because she's a doctor.
Yeah.
So I call her and I'll be like, listen, this is happening. And she'll be like, no, you don't need to go to the doctor just yet. But I think that that's so incredible that we're really trying to make healthcare that accessible. So then this is what I need to ask, because as a country, we know where we sort of stand with healthcare, which is not necessarily so advanced. So what exactly are we hoping we will dive into at the G20? And what are we hoping will be prioritized for our country?
I think a lot of the models you just described will be part of the discussion. So you gave a great example of you calling your aunt and not necessarily having to spend the money to go to the GP because she could answer it quickly for you on the phone.
Yes.
And that saves the health system money. So at the G20, a lot of the discussion will be what are the health resources available, what money, what facilities. We've heard about NHI and trying to link private insurance with government projects.
Yes.
So what is the resource pool? What are the needs of the people and specifically primary healthcare needs? And how do we match those? And again, AI has a great role in doing that and digital tools like telehealth. But you need regulations, which will be another topic of how to make that happen in a safe way.
Beautiful.
The public needs to trust the AI companion. The public needs to trust the telehealth consults. The public needs to trust that when they go to a facility, they don't need to wait all day and sacrifice an entire, working day to get their script for their chronic medication.
100%. And Dr. Rick, we've got so much to still unpack about this. So I'm glad you're not going anywhere because Mzansi, we're still having this conversation. We're setting the big picture in terms of what exactly is going to be happening at the G20 when it comes to health and when it comes to our country. How does the G20 health prioritize really what exactly it is that's happening in the country? But more than anything else, what guardrails keep digital health ethical, private, and fair? And how can we know that we can trust it? Still with us is Dr. Dino Rick, and he's going to be helping us get into that. However, for now, let's jump on over to Cape Town. My beautiful family, are you still feeling good?
It's my feel good breakfast show.
Welcome back, Mzansi. Always so good to be with you. And the beautiful thing is, if you're just joining us, we're only just getting started here on your Feel Good Breakfast show. But we're starting off with a very important conversation because we understand what the G20 is, right? But now we're breaking it down to really get into the nitty-gritty of what is going to be discussed there and how it's going to affect you. So we're on healthcare, and we've got with us none other than Dr. Dino Rick, who's helping us break it down in the best way possible. And more than anything else, understanding the guardrails that keep digital health ethical, private, and fair, because that's the future, right? AI. But how exactly does it play into your life and mine? We're continuing to find out. Now, Dr. Rick, I completely know that when it comes to AI, so many people are a little bit apprehensive. They're not 100% sure. And this is why you said, you are all working on how exactly you can make us feel as South Africans that we can trust it. So then can you talk to us about, what problems is AI solving in the country right now? And more than anything else, what human backup should possibly always be there?
Great. So I think one of the big problems AI is solving is around healthcare shortages. So we see AI companions that can interface like a healthcare companion, solving workforce shortages. So let me give you an example. You chatted about your aunt that you phone. Yeah. Within public health programs, when we have cutbacks and when we have shortages, AI can become that trusted companion that becomes the first point of call for your healthcare advice. Okay. It provides that information, it gives you accurate answers, and it does it around the clock. So primary healthcare is traditionally, 7 a.m. till 5 p.m. if you're lucky in facilities.
Yes.
What if you've got an urgent question at 11 p.m. at night or 2 a.m. in the morning? Who do you ask? How do you get access to services? Yeah. So this becomes a wonderful triage opportunity to provide initial information and guide you to an access point. And we mentioned before, the access point could be telehealth, it could be a pharmacy entry, it could be a public health facility. So it's really, it's filling some of those human resource needs, and it's working with limited human resources.
Yes.
So if you're a nurse in a clinic and you're overwhelmed and you've got an AI companion, could that help lessen your workload and the burden that you're under in a busy facility?
I love that. And you see, this is why I say that that's really just allowing for more access, especially in a country that struggles with healthcare access, right? But now let's then talk about how we can feel more relaxed as South Africans using an AI companion. What are those safeguard rails that almost, really, or rather those non-negotiable safeguards that really allow us to be like, okay, cool, my privacy is going to be respected. My information's not going to go absolutely everywhere. What do we need to know as South Africans that we can be more secure about in understanding that AI AI isn't here to steal information,
sure.
but help more than anything
For
else.
sure. So the South African government and Department of Health has been quite proactive around AI. They have a youth platform for young South Africans that want to talk about their healthcare needs online.
Yes.
It's called BeWise. And on their platform, bewise.co.za, they have an AI companion that you can access.
Yes.
Now, before they allow one to do that or youth to access that, they want to be sure, are the answers correct? How do we know the AI doesn't make mistakes?
Yes.
Is the data and privacy secure? And there's a range of both legislative things around POPIA that the AI companion has to comply with. There is a M&E monitoring and evaluation framework that we've built around the AI to check the accuracy of the answers. We have humans in the loop is very critical. We don't believe on AI operating independently on its own. The human part of healthcare will never change.
Yes.
So that human in the loop, that when a certain question comes up that we're not comfortable with AI asking. A young person talking about maybe self-harm or suicide. We want that person talking to a human.
Yeah.
We want the AI at that point to stop and say, let me refer you to an online counselor. We work, groups like the South African National Depression and Anxiety Group are awesome in terms of their call center. So it's this relationship between government and regulators ensuring that the AI is safe and effective and accurate. Privacy regulations around it so that data is protected, and then human in the loop and referral at the right moment in time.
Yes.
And those three things should give users safety and confidence in using these types of products.
Beautiful. And, you mentioned the fact that human interaction will never, ever go away, which is absolutely incredible.
Yeah.
But then let's talk about the humans at hand, the nurses and the doctors. When we do employ technology and we say, okay, let's use AI, what does it free up our nurses and doctors to be able to really do? How does it help them necessarily and really just work in conjunction to make our healthcare better?
I'll give you one real easy example. You imagine a busy facility, a busy clinic, maybe an ER that even you or I have sat in and we're waiting for hours on a Sunday. There's a part of the journey that is history taking, that is having a conversation to understand what your ailment is.
Yes.
You could deploy AI as an example, as a history taker to collect the information. When they see the nurse or doctor, there's a very succinct, beautiful summary of all your, the conversation you've just had with the AI for 45 minutes. You aren't rushed in having that conversation. The doctor and nurse that has to see a busy waiting room isn't being briefed on the history taking because they've got the AI companion. So the quality of that interaction improves. You have an accurate history. The patient doesn't feel rushed in talking about their problems, and the doctor or nurse can make the best decision possible. There's many examples like that, but that's a real practical one.
I love that one because it almost makes you feel like you're at ease, almost being like it wants to make our lives easier as well, on top of the nurses and the doctors, which is incredible, right? But then I want to make you our Minister of Health for 2 seconds, Dino, because I feel
too much
like...
pressure.
No. I believe in you, okay? You can do this. So we want you to pretend that this is the G20 here at Expresso, and you have the floor. What is one ask that you would give to the G20 to hopefully make our healthcare just a little bit better, a little bit more advanced here in South Africa?
I think that the biggest ask for me, again, would be embracing the opportunities that technology brings. I think we have a lot of gaps in our system and we've struggled a long time to fill them.
Yes.
And we haven't maximized technology to the full. And that, AI, telehealth, there's a range of opportunities. My ask at the G20 would be, how do we be purposeful and plan a roadmap to really make these tools accessible and to every South African? How do we make sure that they aren't expensive, they're affordable, even free, like the service on the current government website?
Yes.
And how do we learn from global best practice and bring that to South Africa? So part of it is a learning agenda. Part of it is a purposeful roadmap to do this well, and working with not just as a country on our own, but with collaborators, both in the private sector and the region, other governments.
Beautiful. Well, you know what, Dino, you have broken this down so beautifully for us. Thank you as well, I think, for even putting us at ease to really understand how AI can help us. Because like I said, it is daunting, but people like you coming and just making it simplified for us makes it that much easier to even just put into our own lives. So thank you.
Thanks, this has been great.
Awesome. It is Dr. Dino Reck that is here letting us in on what exactly is going to be discussed at the G20 when it comes to healthcare, and more than anything else, my friend, giving us a practical roadmap when it comes to tracking and really understanding what is going to be spoken about, but also how it could possibly help us. What are those commitments that we hope will come out of the summit, and what are the first signs of progress in South Africa that could possibly let us in that we are on the right track? For many more updates on this G20 series, stay with S3 and our platforms, because we've got so much more information coming at you right here on your Feel Good Breakfast show. For now, though, my friend. We still got so much to do. You got to make sure you don't go anywhere. My Cape Town family, what are you guys up to on that side?